Welcome to a video that explores the intricate world of diabetes. This is a topic that affects millions worldwide and is of particular interest to those pursuing a career in medicine. Today, we'll delve into the depths of diabetes, a common metabolic disorder characterized by high blood sugar levels. Our journey will underscore the importance of early diagnosis and treatment. By the end of this video, you'll have a deeper understanding of what diabetes is, how it develops, and how to manage it. To understand diabetes, we first need to understand the role of insulin in our bodies. Insulin, a hormone produced by the pancreas, is the key that unlocks our body's cells, allowing glucose or sugar from the foods we eat to enter and be used for energy. But what happens when this key doesn't fit the lock, or worse, when there's no key at all? This brings us to the two main forms of diabetes, type 1 and type 2. In type 1 diabetes, the body's immune system goes rogue, destroying the insulin-producing cells in the pancreas. Without insulin, glucose piles up in the bloodstream instead of being used for energy. In essence, it's a case of the missing key. On the other hand, type 2 diabetes is a classic case of a key that doesn't fit the lock. Here, the body becomes resistant to the effects of insulin. Despite having enough insulin, the body struggles to move glucose into the cells, leading to a rise in blood sugar levels. Though the mechanisms are different, the result is the same in both types: high blood sugar levels, which over time can lead to serious health problems. But what makes some people more prone to developing diabetes than others? Genetics plays a crucial role. If your parents or siblings have diabetes, your risk of developing the condition is significantly higher. But it's not all in the genes. Lifestyle factors also contribute significantly, particularly for type 2 diabetes. A diet high in processed foods and sugars, lack of physical activity, and excess weight, especially around the waist, are all major risk factors. So, to put it simply, diabetes develops when the body can't effectively regulate its own blood sugar levels, either because it can't produce insulin, type 1, or because it can't use insulin properly, type 2. And while we can't change our genes, we can certainly influence our lifestyle choices to reduce the risk of developing type 2 diabetes. In essence, diabetes is a result of the body's inability to produce or effectively use insulin. Identifying diabetes early can prevent serious complications. But what should you look out for? Let's dive in. When it comes to diabetes, symptoms can sometimes be subtle, but they're important to recognize. One of the first signs you might notice is excessive thirst. This isn't your typical "I just ran a mile" thirst. It's a persistent, unquenchable thirst that doesn't go away, even after drinking lots of water. Another common symptom is frequent urination. The body tries to get rid of the excess sugar in the blood by flushing it out in urine, leading to more bathroom breaks than usual. You might also experience fatigue. This isn't just feeling tired after a long day. It's a constant feeling of exhaustion that doesn't get better with rest. And if you have type 1 diabetes, you might see a sudden and unexplained weight loss. This happens because the body starts burning fat and muscle for energy since it can't use sugar properly. But the implications of diabetes go beyond these immediate symptoms. Long-term, high blood sugar levels can lead to serious complications. These can include damage to the eyes, potentially leading to blindness, kidney damage, which might result in kidney failure, nerve damage, causing tingling, pain or numbness in the hands and feet, and heart disease. So, awareness of these symptoms and complications can lead to early diagnosis and more effective treatment. Keep these signs in mind and remember, knowledge is the first step towards action. Diagnosis of diabetes is typically confirmed through blood tests, but what happens after diagnosis? To answer this, let's dive into the diagnostic tests for diabetes. The two most common tests are blood glucose level testing and hemoglobin A1C, or HbA1c testing. Blood glucose level testing measures the amount of sugar in your blood at any given time. On the other hand, HbA1c testing provides a picture of your average blood sugar control for the past 2 to 3 months. After a diabetes diagnosis, it's crucial to regularly monitor blood sugar levels. This allows you to track your body's response to medications and lifestyle changes and adjust your treatment plan accordingly. Additionally, keeping an eye on other health indicators such as blood pressure, cholesterol levels, and kidney function is essential to prevent complications. Remember, diabetes is not a one-time diagnosis. It's a lifelong commitment to monitoring and managing your health. Regular monitoring is key to managing diabetes and preventing complications. The management of diabetes requires a comprehensive approach involving lifestyle changes and sometimes medication. For both type 1 and type 2 diabetes, a balanced diet and regular exercise play a crucial role in maintaining blood sugar levels. Incorporating foods low in sugar and high in fiber, along with adequate physical activity, can significantly improve the body's insulin sensitivity. Yet, diet and exercise might not be enough, particularly for those with type 1 diabetes, where the body doesn't produce insulin at all. Here, insulin therapy becomes essential, often administered via injections or insulin pumps. In type 2 diabetes, where the body doesn't use insulin properly, a range of medications can be used to improve insulin production and effectiveness. An individualized treatment plan is key, as every person's body and lifestyle are unique. This is where a multidisciplinary healthcare team comes into play, including endocrinologists, dietitians, and even psychologists. They work together to tailor a treatment plan that best fits the patient's needs. In our age of technological advancement, new treatment options are constantly emerging. Continuous glucose monitors and smart insulin pens are just a few examples of how technology is helping to make diabetes management more efficient and less intrusive. Managing diabetes is a lifelong commitment, but with the right approach, it's entirely possible to live a healthy and fulfilling life. We've covered a lot of ground today, from understanding what diabetes is to how to manage it. We dived into the role of insulin, the differences between type 1 and type 2 diabetes, and the symptoms to look out for. We also discussed the diagnosis process, the importance of regular monitoring, and the various treatment options available. This understanding of diabetes is crucial to your future medical practice. Thank you for watching. Remember, your knowledge can make a difference in the lives of those affected by diabetes.